So thank you. I'm proud to be a NovaSight advisory board member, but non-paid. I always mention that. And just about history of the CureSight studies. So our first study was basically a prospective single-arm proof of concept study in which we had 20 participants, but a really wide age group, so from 4 to 15 years. And because we didn't know if this worked or not, these children were treated for 6 months on a large screen, and they were treated for 3 months, 5 days a week, and then for 3 additional months for 3 days a week. And at 6 months, we found that we had a 1.9 visual acuity improvement and 89% adherence. And when we rechecked them at 1 year, we saw that the acuity gains were pretty much stable. So that basically showed us that it was safe and effective. And then we decided we wanted to repeat the results in another location to see that it's not just a bias of space. And the second pilot study was done in China, and they had 34 participants, age 4 to 9, treated for 12 weeks, and they also showed that they had the same visual acuity improvement of 1.8 lines. So we reached 2020, and at that time, the binocular, the report by the American Academy or the Ophthalmic Technology Assessment stated there's no level 1 evidence to use binocular treatment as a substitute for current amblyopia therapies, so patching and atropine. So at that point, we decided we'd go on to an RCT, which would be a non-inferiority study, hoping the CureSight would be shown to be non-inferior to patching. And this study included 103 children aged 4 to 9. And by the end of 16 weeks, they improved by 2.8 lines and also had improvement in stereo acuity and binocular visual acuity, and we concluded that the CureSight in this set of patients was non-inferior to patching. And as you will note, visual acuity gains were actually quicker with the patching group, but at 16 weeks, the CureSight group improved by 2.8 lines and the patching group improved by 2.3 lines. At this point and in this study, the CureSight was shown to be non-inferior to patching. Nevertheless, if you look at visual acuity improvements at each follow-up visit, they were significant in each of the groups at each follow-up visit, but you can see that the patching group kind of plateaued by 12 weeks, and the CureSight group continued to improve. So just to show you an example of our patients, these are identical twins, and they're the sisters of our older patient who had bilateral amblyopia due to bilateral hypermetropia. And we met them when they were 7 years old, and we put them in glasses because their refraction was almost identical, +6 and +825. Both saw 20/60 in their amblyopic eye, being in glasses for 8 months, and they have left suppression and only 200 arc seconds of stereo. So twin number 1 was randomized, and what we found out later was the CureSight, and by the end of 16 weeks, she saw 20/20 in her amblyopic eye fused and had 30 arc seconds of stereo. And we keep on following our patients. So in January of this year, she is now 11 years old. She continued to improve and sees 20/20 with the same cycloplegic refraction, is still fused, and has 40 arc seconds of stereo. So most of us will think that she's stable compared to end of study and also cured of amblyopia. However, interestingly, her identical twin, same visual acuity, almost same refraction, same stereo acuity, but with the way we had to prescribe the glasses for the RCT, where you can only reduce 1.5 diopters from the cycloplegic refraction, she had an exotropia at near and was non-eligible for our RCT. So she patched, and she improved from 20/60 to 20/40 plus, sometimes 20/30, and she also improved with her stereo acuity to 80 arc seconds, but she still had suppression. And then when the CureSight became available, She did the CureSight for 6 months and improved to 20/20 with exactly the same binocular function as her identical twin. So she too is kind of cleared of, or cured of amblyopia, but what was important for this family was that the identical twins were identical again. So our conclusion from this study was that the data support the use of the CureSight as an alternative to patching in this type of amblyopia. So only last year, the preferred practice patterns were updated, and it was now noted that, or acknowledged that binocular treatment is effective. And we wanted to also show that the gains of our patients at 16 weeks were stable at 1 year. And it's not that we think amblyopia should be treated for only 16 weeks. On the contrary, we think these patients need to be tapered, but that wasn't the study design for the RCT. So we offered these patients another optional visit with 3 months of no treatment and then at 1 year with no treatment. And although there was partial loss of visual acuity gain of less than 1 line, the gain of 2 acuity lines was still statistically significant, and the rate of recurrence was similar to other studies, albeit we note that the PEDIC study also included strabismic amblyopes. It was interesting to note, however, that those patients that were cured of amblyopia and had less than 1 line of visual acuity difference between the amblyopic and non-amblyopic eye did not recur, and actually this was reported in some other small studies by other researchers. We do, however, note that there is a potential for further improvement with longer treatment and tapering of treatment. So this is a case of a 16-and-a-half-year-old teenager with known anisometropia who actually wore glasses from the age of 4.5 years, and he patched. We came to know him when he was 16 years old with visual acuity corrected in the amblyopic eye of 20/40 with anisometropic hypermetropic amblyopia suppression and really very, very poor stereo acuity, that poor that we repeated the exam and had him come and do a stereo test on another day. But on one of the algorithms of the CureSight, at 16 weeks, he actually improved to 20/20 with fusion and stereo 40 arc seconds. And then we didn't meet him again until 2 weeks ago when he came in because he's studying a lot, he's finishing his degree, and he has astenopia. And his non-corrected visual acuity in the former amblyopic eye was 20/30. His refraction remained quite unchanged, but in the clinic, adding the difference in the refraction between the eyes, he became 20/20 again and had 50 arc seconds of stereo. So actually, he was also stable compared to his end-of-study results. And this is an example of completely off-label treatment, but it shows you what you can do in the real world. This was an 8.5-year-old girl with 2200 vision who presented to her treating ophthalmologist with a posterior lenticonus cataract. And she underwent cataract extraction and IOL implantation, and with that alone, her visual acuity improved to 21/40, and she was prescribed patching. But she could not, and did not patch for over an hour and a half a day, and they came in wanting to actually rent the CureSight. So when we met her in 2024, her visual acuity improved to 20/80. This is a refraction, so she has the professional amblyopia. She suppresses in her cataract eye and has actually nice stereo for a patient with a cataract, 200 arc seconds. And we had a long discussion with the parents because we told them we have no data and no studies on deprivational amblyopia, let alone monocular cataract, but they mentioned there's no problem. She's not going to patch anymore, so if she doesn't do the CureSight, she will do no treatment for amblyopia. Atropine drops were not, they didn't want to do that. So we kind of compromised, and I spoke to the girl, and we said she will continue patching an hour and a half a day, and we will add an hour a day of CureSight. And lo and behold, at 10 weeks, she improves to 20/50. She does suppress still in her right eye, but she has 80 arc seconds of stereo. So this goes to show that sometimes combination therapy in the real world can work. And finally, for the coverage, they wanted to show that the CureSight could be superior to patching. And so the cohort was enlarged to 149 patients, and only patients with 60% adherence were included in both groups. And this time, the CureSight was shown to improve by 2.7 lines at 16 weeks and patching by 2.2 lines. But here there was statistical superiority for the CureSight. And also what is important that, indicating that combining cohorts from two regions in the world did not change the effect of the treatment. So we're very thankful to David Hunter and their group for not showing us only that we know that amblyopia treatment is very cost effective, but also that digital therapeutics are cost effective, although much more expensive. And the data support the use of these devices as an alternative to patching, especially in non-compliant patients, patients that lack response to patching, social stigma, and discomfort. Thank you.